Good morning. It's your daily dose of complete health with your local chiropractor, Patrick Hogg. I want to go through some statements that I hear every single week. But Patrick, I have a leg length discrepancy, therefore, how can I balance my pelvis? Or Patrick, I've been told that osteoarthritis runs in my family, therefore, how do I get this better? Or Patrick, I was born with a scoliosis, therefore I can't be X. It's so common for me to hear statements that have been told to people that are not necessarily true. The most common one that I'll see is if someone has seen a chiropractor or another physical therapist before, is really around stuff like scoliosis, osteoarthritis, and leg length. It's almost daily that someone will come and tell me they've seen another practice member who has told them that their legs are different length. Now, ironically, a lot of people have a very minute leg length discrepancy. However, there are mechanical changes in the body, in the muscles, and in the nerve system that can start to create these discrepancies. And often it's not actually an anatomical difference. Same again with things like scoliosis. A lot of scoliosis is actually trained into the body as what we call a functional scoliosis, which basically means the muscles and the nerves have adapted within our system to hold awkward and weird positions. And so there are a lot of myths that are thrown around by experts that are not necessarily true. And it is not necessarily true that you cannot correct the dysfunction. However, you have to know the difference between an anatomical and a functional change. And this is the point that seeing the expert and having someone explain it to you should give you. Now, another one that I see all the time is osteoarthritis runs in my family. Now, interestingly, osteoarthritis isn't necessarily a genetic predisposition, and it's also not an age-related predisposition. And the reason why I know this to be true is that I have seen people as young as their teens that are already displaying degeneration in their spine, which tells us it cannot be an age-related thing. And I've also seen multiples of peoples within family where one will have degeneration and the other one does not. And so we have to ask the question, what is it that really leads to these changes, such as scoliosis, changes in leg length, and changes in arthritis, especially degenerative, on our body? And it almost always comes down to one thing: changes in structure and function of our body. Now, if the muscles and the nerves and the joints on our body will start to change, e.g. muscles start to spasm, joints start to come out of line, we'll start to see things like a scoliosis start to occur, or things like a leg length discrepancy start to occur, which will start to lead to indiscrepancies in how we start to load our joints. These indiscrepancies over periods of time are really the things that start to lead us to things like arthritis or muscle strains or nerve irritations or inflammation in the body, which in turn is the reason why we'll start to see degeneration in the joint, not necessarily because of our genetics, because of our lifestyle choices. Now, one thing we always have to consider with genetics is, does our genetics predispose us? Because with everyone, their parents could have had a heart attack. However, if they're not eating the same sugar and salty diet that their parents maybe ate, full of fats, and not exercising and smoking 20 cigarettes a day, then the likelihood is that person's genes are going to follow what their parents did, because a lot of it would have been lifestyle factors. However, our genes can increase the risk as opposed to cause the risk. So if maybe you're struggling with some of these problems, and maybe you have a couple of myths that you want busting, ask your practitioner if what you've heard before is necessarily true, and especially if it's come from Dr. Google or Facebook, always check with a professional that may have a better understanding or at least be able to send you to the right direction. Don't necessarily always take the first bit of information as gospel. Patrick here from Complete Health. This is your daily dose, and I'll speak to you again soon. Take care for now.